Have you ever wondered why women engage in anal sex? The participation of just heterosexual people in anal sex has become increasingly common, but there's really little knowledge about why women choose to engage in it. Do they feel like they need to please their partner? Or is it for their own pleasure? Maybe you're scared. But by the end of this video, you'll understand why that's not necessary at all. You'll know exactly how to prepare safely. You'll understand what separates painful experiences from pleasurable ones. You'll know how to decide if this is right for you. Scientists studied 32 women to understand why they said yes. They found 6 distinct reasons. Here's the first one. 62% of these women were under the influence when they tried it. They were high. They were drunk. Their judgment was altered. The second reason is going to surprise you even more. Welcome back to the Female Health Podcast. I'm Dr. Leah Parker, a gynecologist and women's health specialist with over 30 years of experience helping people over 50 with their intimate health. Comment where you're from and what time it is. I'd love to know who's watching. Now here's what really matters. It's not just why women do this. It's what separated the women who felt pleasure from the ones who described it as traumatic. Some women in this study said it felt amazing. Others used words like painful, humiliating, something they never wanted to repeat. The difference between those two experiences starts with understanding something about your body, something no one ever explained. Here's the second reason. 49% of women said they personally wanted to try it. Some of them saved it as a special gift for a specific partner. They chose it deliberately. So why do some women choose this while others end up hurt? Your body has 2 sphincters in this area. One you control completely, like your mouth. You can open it, you can close it. The other one works automatically, like your heartbeat. You can't directly control it. This is why rushing never works. That automatic sphincter needs time to relax. But here's why your body can actually handle this. This area has the most nerve density in your entire body. The pudendal nerve connects it directly to your genitals. This is why some women describe intense pleasure. The nerve connection makes it possible. Now here's the third reason. Over half of the women in this study, 53%, said they were in situations where they couldn't say no. They didn't feel safe refusing. They felt they had no choice. So now you know 3 reasons. 62% were under the influence. 49% genuinely wanted it. 53% couldn't refuse. And this is where it gets critical. What separated the painful experiences from the pleasurable ones? It came down to one specific thing. That one specific thing is lubrication. Going slow. Your anus doesn't self-lubricate like your vagina does. When you're aroused, your vagina produces natural lubrication. Your anus doesn't do this. Without lubrication, you risk injury. You risk bleeding. The tissue is delicate. Self-centered partners who skipped this step created the painful experiences. Women described it as humiliating. They said they never wanted to try again. Now here's where the reasons get more complicated. Here's the 4th reason women engage in anal sex: pleasing a partner. They wanted to fulfill his desires. Sometimes this came from love, sometimes from obligation. The line between the two isn't always clear. That uncertainty is exactly what makes this complicated. The 5th reason is avoiding vaginal sex. Some women chose this during menstruation. Others used it to prevent pregnancy. For them, anal sex became a practical alternative. There's one more reason. It's the darkest one researchers found. If this is helping you understand, hit the like button. Comment 1 if any of these reasons match your story. Comment 0 if not. So now you know why lubrication matters. But even with perfect physical preparation, there's still one thing that determines whether you end up like the women who genuinely wanted it, or the women who felt they had no choice. The 6th reason is quid pro quo. Some women engaged in anal sex in exchange for money or drugs. This was transactional. With those 6 reasons, you've already picked up some of the preparation steps. I'm going to walk through them clearly now. But even with perfect preparation, some women still end up regretting it. That's avoidable too. I'll explain how. You start impossibly small. Begin with a well-lubricated finger. Just one. Let your body adjust to that sensation first. This might take days. That's normal. Then you move to a small anal toy. But here's what's critical. The toy must have a flared base, a wide base that prevents it from going all the way inside. I've seen too many people in the emergency room, Objects without a flared base get sucked inside. Your rectum creates suction. Once something goes in without a stopper, you can't get it out yourself. This means a trip to the ER, a colonoscopy, sometimes surgery. This is not a trip you want to make, so always use toys designed specifically for anal play. Always check for that flared base. Now about lubrication. Use water-based or silicone-based lubricant. Get a bottle with a one-handed pump. This prevents contamination. You'll need to reapply constantly, more than you think. But starting small isn't enough. There's a specific progression most people get completely wrong. Your body needs time between each size increase. Rushing this causes the injuries. And if you skip the safety checklist, you're putting yourself at serious risk most people don't even know about. Work up gradually. Never rush to full size. Your body needs time to adjust. This might take weeks. Some people need months. There's no universal timeline. Each time you increase size, use more lubrication than before. Reapply during the process. Your anus absorbs lubricant quickly. Here's what most people don't know about risk. Anal intercourse carries the highest HIV transmission risk, higher than vaginal sex. The tissue in your rectum is fragile. It absorbs easily. Even tiny tears you can't feel create entry points. This is why condoms are non-negotiable, every single time. You also need vaccines. Hepatitis A protects you from infections that pass through fecal matter. HPV vaccine protects against anal warts, anal cancer. These are real risks people ignore. Get STI testing before you start. Make sure your partner gets tested too. Establish safe words before anything begins. Yellow means slow down. Red means stop immediately. No questions asked. If you're a partner watching, here's what you need to understand. Her comfort determines everything. Not your technique, not your experience. Her comfort. If she's tense, you stop. If she says it hurts, you stop immediately. Pushing through pain causes the trauma we talked about. Communication matters more than anything else. Ask her how she feels. Listen to her answers. Watch her body language. Now remember what I said earlier. Perfect physical preparation isn't enough. There's still one factor that separates the women who wanted it from those who couldn't say no. This isn't about another technique. It's about something deeper. Only do this if you are curious. Not to please someone else. Not because you feel pressured. Not because you think you should. The women in the study who were high, who couldn't say no, who felt pressured, those are the ones who described trauma. They had the physical preparation, but they didn't have genuine desire. The women who experienced pleasure had three things: genuine desire, proper preparation, patient partners who listened. Most women think they can tell the difference between curiosity and pressure, but many don't realize they're being pressured until after it's already happened. Let me tell you this. I know this is a sensitive subject. It might be hard to hear. If you want me to write this down so you can read it at your own tempo, process it privately, or share it with someone you trust, comment the word guide below. Of course, you can add a question or a comment. I'm happy to help, and you're safe here. Here's how to recognize pressure before you go through with it. If you feel guilty for saying no, if your partner gets angry when you hesitate, if you're doing this to keep the relationship, these are signs you're not ready. Genuine curiosity feels different. It feels like exploration, like something you want to try for yourself. For partners watching, here's what support looks like. You accept no without argument. You check in constantly during the experience. You prioritize her comfort over your pleasure. You stop the moment she's uncomfortable. Her signals matter more than her words sometimes. If her body tenses up, you slow down. If she pulls away, you stop. Women over 50 are discovering this can be pleasurable. It requires intention. It requires care. It requires choice. Communication during the experience is essential. Tell your partner what feels good, what doesn't. Stop immediately if anything hurts. Pain means something is wrong. Safe words exist for a reason. Use them. Check my store for other intimate health guides that can help you navigate these conversations.